Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about insulin resistance, what it is and why it matters. What it is, insulin resistance is a metabolic condition where your body's cells become less responsive to the hormone insulin. Insulin's normal role. Insulin is produced by the pancreas and acts like a key that unlocks your cells to allow glucose from the bloodstream to enter and be used for energy or stored for later use. Insulin resistance is a precursor to type 2 diabetes. Insulin resistance. Even when insulin is present, glucose has trouble entering the cells. The body's response to compensate, the pancreas produces more and more insulin, trying to force the cells to take up glucose. This can lead to high levels of both glucose and insulin circulating in the bloodstream. Not a disease initially. Insulin resistance itself isn't typically classified as diabetes, but it's a major risk factor and a key step in the development of type 2 diabetes. Many people can have insulin resistance for years without developing diabetes. Here's a simple analogy. Imagine a door, your cells, and a key, insulin, that unlocks it to let sugar in. Insulin resistance. The lock is becoming stiff and harder to turn. The key still works, but the body has to make more and more keys, insulin, to get the door open. Blood sugar levels might still be normal, but the body is working harder. Prediabetes. The lock is now very stiff, and even with many keys, high insulin, the door isn't opening properly. Sugar starts to build up in the hallway, bloodstream, but not so much that it's officially jammed. Diabetes. Risk factors that suggest insulin resistance include overweight or obesity, especially excess weight around the waist, abdominal obesity, high blood pressure, high triglycerides, low HDL cholesterol, family history of type 2 diabetes or cardiovascular disease. Blood glucose levels. While not a direct measure of insulin resistance, elevated fasting blood glucose levels can be an indicator that insulin isn't working effectively to clear glucose from the blood. Hemoglobin A1C test. This reflects your average blood sugar levels over the past 2 to 3 months. Higher A1C levels can suggest insulin resistance is contributing to poor blood sugar control. Lipid panel. High triglycerides and low HDL are associated with insulin resistance. Key differences summarized. Feature, primary issue, insulin resistance, reduced cellular response to insulin. In diabetes, persistently high blood sugar levels due to insulin issues. Feature, insulin levels. In insulin resistance, often high as the body tries to compensate. In diabetes, can be low, type 1, high, early type 2, or low, late type 2. Feature, blood glucose. In insulin resistance can be normal or elevated, but not consistently high enough for a diabetes diagnosis. In diabetes, consistently high blood sugar levels, meeting diagnostic criteria. Feature, disease status. In insulin resistance, a metabolic condition and major risk factor. In diabetes, a chronic metabolic disease. Feature, reversibility. Insulin resistance is potentially reversible with lifestyle changes. In diabetes, type 1 is not reversible. Type 2 can sometimes be reversed or managed with lifestyle and/or medications. So I hope you have found this podcast interesting. Please consider buying my new book, 100 Pathways to Longevity add 25 years to your life.